Hi, my name is Jourdain Watson, and I'm an FNP student at Georgia Southwestern. The following is my head-to-toe assessment. This is Brittany. She has agreed to be my patient today. I have taken a set of vital signs prior to entering the exam room. Have also taken a height and weight. All right, Brittany, I'm going to start today. First thing I'm going to be looking at is skin. That's going to be just an ongoing assessment as I move through the systems. Just checking to make sure her skin is even, pink in color, that there's no areas of cyanosis, no areas of pallor or lesions. I'm also going to be paying attention to her skin temperature, making sure that she is warm and dry, that there's no areas of cool, clamminess, or skin breakdown. Also going to check real quick, just looking for skin turgor as an indication of hydration status. She doesn't have any kind of skin tinting. Hers is within normal limits. And then I'm going to start out at the top of the head, working at the top, looking at her hair. Her hair is clean, dry. It looks healthy. There is no patchy areas of baldness or hair loss. There's no areas of infestation that I can see. Her hair is bright, shiny, good quality, good color. The next thing that I'm going to look at is her nails. Checking for any areas of like ridges or a change in color like blue or purple. Make sure there's no clubbing. Hers are clean, rounded, and no areas of clubbing there. Moving on to her head, I'm going to start here at the top. Just feeling for any areas of indentation, asymmetry, looking for any areas of breakdown here in the back at the crown of the head, which is especially important for bedbound patients. Checking also for any like tenderness. Do you have any tenderness there? No, anywhere? Okay. I'm going to move on to her face. You can see that her facial characteristics are symmetrical. If you would raise your eyebrows for me, and then smile, and then stick your tongue out. Puff your cheeks out real big for me. All right, so she can do all those things, which shows me that her cranial nerves 7 and 11 are intact. Moving on, I'm going to feel here for the TMJ joint. If you'll open and close your mouth. And I don't feel any areas of crepitus, no cracking. It's a smooth movement there, so that's within normal limits. Okay. While I'm on the face, I'm going to check her trigeminal nerve, which is cranial nerve 5, by touching her face here. We'll have a Q-tip, and I'm going to have her close her eyes and tell me if she feels sharp or dull. Close your eyes. I want you to, this will be dull, this will be sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. All right. So she did perfectly with that. Obviously her trigeminal nerve is intact. Moving on to the eyes. I'm just going to be kind of observing the outer structures of her eyes. There's no swelling to the eyelids. There's no drainage from her eyes. Her sclera are pink. I mean, her conjunctiva are pink, and her sclera are shiny white. There's no yellowing. Her corneas are symmetrical in color. The next thing that I'm going to do is do a corneal light exam. All right, Brittany, I'm going to shine a bright light in your eyes. I just want you to look straight ahead. She has consensual constriction of the pupils. The next thing I'm going to do is a confrontation exam. I'm going to have you hold this over one eye, and then I'm going to shine the light in the other. And then if you pull that away, I can do this here. And then I'm going to cover this eye. And I'm just checking for consensual constriction in the covered eye. The next thing I'm going to do is check her extraocular movements. I just want you to look at my finger and follow it in each direction. Okay, so she did that without having any kind of nystagmus, which shows that her cranial nerve is intact, and that her pupils are equal round, reactive to light with accommodation. All right, so the next thing I'm going to look at actually is going to be her ears. I'm going to inspect the external structures here, looking for any kind of lesion, any kind of drainage from those, any kind of deformity or asymmetry between the ears, any tenderness with palpation. Does that hurt at all? No. Especially, pressing on the tragus, does that hurt? No. Okay. She doesn't have any tenderness there. I'm going to inspect the inner ear. I'm looking for any kind of drainage or redness or inflammation there. Her tympanic membrane is pearly gray in color. The cone of light is present at 7 o'clock in the left ear. And then the same with the right ear. There's no drainage, no redness. The cone of light is present at 5 o'clock in that ear. All right, and then I'm going to do a whisper test where I'm going to have her cover one ear, and then I'm going to whisper, and she's going to tell me what word I said, and then we'll repeat it with the other ear. Okay. Cat dog. Purple green. Okay. So her whisper test is intact, showing that her cranial nerve 8 is intact. The next thing I'm going to start at is the nose. I'm examining her nose, looking for symmetry, looking for any drainage. I'm going to have her occlude one there and blow out the other side and make sure that her nostrils are patent. You want to do one side and blow out, and then the other. And she has positive airflow out of both ears, which that's normal. And then I'm going to examine the interior of her nose, making sure that her nasal turbinates are pink in color, that there's no obstruction there, that she doesn't have any polyps in her nose. And the next thing I'm going to do, I'm going to have you close your eyes, and I'm going to ask her to smell, and she's going to identify the odor for me. So that's correct, and that shows that her first cranial nerve is intact. All right, so moving on to the mouth. I'm going to examine her teeth and her gums, also looking at the exterior of the mouth, looking for any lesions, any breakdown, any chapped lips, any dryness there. You'll open your mouth, and her teeth are in good shape. There's no broken teeth. There's no caries, obvious caries. Her gums are pink, and if you'll let me look at the back of your throat, stick your tongue out for me. And her uvula is midline. Her tongue is moist and pink. It's not beefy red. If you will open your tongue and say "ah" for me. And so all that tells me that her cranial nerves 9, 10, and 12 are intact, as well as that she can speak without being hoarse. I'm going to move on to her neck. For the next part of the exam, I'm going to just kind of inspect, making sure that I don't see any kind of swelling there. I don't feel any kind of masses, no bulging. Is there any tenderness when I feel your neck? No. Her trachea is midline. If you will, I'm going to put my hand here. I want you to turn your head against my pressure here. All right, here. You will turn your head all the way to the side as far as you can, and then the other side. So she has full range of motion in the neck. She doesn't have any kind of jugular venous distension that is apparent. I'm going to palpate her neck for her thyroid gland, and it is midline. I don't see any sign of like goiter. If you will swallow for me. And her thyroid gland is displaced lateral or upward when she swallows. I'm also going to feel here for lymph nodes in the pre and the post auricular areas, in the occipital area, the parotid area, the jugulogastric area, the submandibular area, in the submental area, in the deep cervical chain and the superficial cervical chains, and the supraclavicular. And I don't see any signs of swelling there or any enlarged lymph nodes. Moving on to the heart, I'm going to listen to her heart sounds. I'm going to check for bruits in the carotid arteries using the bell of my stethoscope. There's no bruits. And I'm going to listen to her heart. Her heart sounds are regular. I'm going to check her pulses. So the temporal, and those are normal, they're 2+. Her carotid, and that's normal, it's 2+, easily palpable. The brachial pulse, those are normal, 2+. The radial pulse, normal, 2+, as well as her ulnar pulse, which are normal. Her femoral pulses, again, normal, 2+. And the popliteal pulses, they are normal and 2+, and the dorsalis pedis pulses, they are normal, 2+. I'm going to locate the point of maximal impulse, also known as the apical pulse. Which when undressed can also be visible. Moving on to the lungs, I'm going to observe her for posture. She is straight posture. There's no posturing, no tripoding. Her breaths are even. They're non-labored. The rate is appropriate. Her depth of breathing is appropriate. I'm going to take a listen to her breaths anteriorly and posteriorly. And her lungs sounds are clear. There's no wheezing or crackles. All right, I'm going to have you lean back here, and then the next part, I'm going to inspect her abdomen. I'm looking for shape and color and contour. And her abdomen is scaphoid and contour. She has even color There is her aortic pulsation is present and visible. I'm going to listen in each of the 4 quadrants for vowel sounds. Starting in the right lower quadrant and working clockwise. She has active vowel sounds in all 4 quadrants. I'm also going to listen with the bell of my stethoscope for arterial and venous sounds. Listening at the aortic and renal arteries. I'm going to percuss her abdomen next. There's both areas of tympany and dullness. And then I'm going to move on to palpation. Palpating first, I just want you to tell me if there's any tenderness. Starting first with light palpation, any tenderness, and then moving on to deep palpation of the liver, the spleen, and the kidneys. Any tenderness there? And she has no tenderness, and there is soft. None of the organs feel enlarged. I'm going to have you sit up for me. And then on the back, I'm going to test for CVA tenderness here. I'm going to pitch her back. I want you to tell me if you have any tenderness at all. And if she had any tenderness there, it could indicate kidney dysfunction. The next thing that I am going to move on to is the musculoskeletal system. I'm looking for just general symmetry. I observed her gait when we walked into the exam room. It was equal. There was no alterations in gait. Her extremities are all symmetrical. Her muscle size is appropriate. She has appropriate symmetry and tone. And her range of motion is intact. I'm going to have you kind of open your, hold your arms out for me. I want you to hold them to each side. Both arms. And then up to your head. Right back. I want you to do the same thing with your legs. Raise each leg for me, one at a time. So she has appropriate range of motion. I'm observing her back for any curvature of the spine, which hers is straight. And then I'm also going to observe her neuro system, checking the peripheral nerves for sensation to light touch. I'm going to have her close her eyes and tell me if she feels dull or sharp, again, like we did with the face. Dull, sharp, dull, dull, sharp, sharp, dull. So her peripheral nerves are intact. I'm going to use my reflex hammer to elicit some of the reflexes here. Alright, so the first thing I'm going to do is check her Achilles tendon reflexes. I'm looking for plantar flexion of the foot when I tap her her tendon here. Intact. And that one's intact. I'm going to check her Babinski reflex by rubbing the heel of the reflex hammer along the ball of her foot, and I'm looking for flexion inward of the toes. Alright, so that is intact. Alright, then I'm going to move on here and do her triceps reflex. And I'm looking for kind of outward flexion of the arm. thing with the brachial reflex. As well as the brachioradial reflex. And also the patellar reflex. And those are all intact. Just to check her cerebellar function, I am going to do a Romberg exam. I'm going to have you stand up for me. This is a test for proprioception. I want you to just stand with your hips at your side, and I'm just kind of standing close by, observing for any excessive swaying. I want you to close your eyes and do the same thing. Again, I'm just making sure there's no excessive swaying there. And then I'd like for you to walk back and forth here with heel to toe. And then on the way back. And so that is normal. If you want to have a seat again, I'm going to check rapid alternating movements. I want you to take your hands and go back and forth, up and down for me. And then can you tap your foot on the floor as quickly as you can? Other one. And then both hands, I want you to do each finger to your thumb and back. And do one at a time. Good. So that concludes our test for cerebellar function and my head to toe assessment. Thank you very much.